Hi, I'm Jordan McDonald, staff writer with GovCIO Media and Research. I was joined by Sarah MacDawutey, Acting Deputy Director of Innovations within the VA. The agency is using low to no cost pilots in order to test and experiment with innovations that eventually they could hope to scale to the larger VA community, whether it's clinicians, veterans, and patients alike. These innovations are designed to help alleviate or automate some of the tasks that VA is doing. It's one of their ways that they're tackling emergent technologies and trying to stay ahead of the curve when it comes to government's use of technology. Hi, I'm Jordan McDonald, staff writer with GovCIO Media and Research, and today I'm joined by Sarah MacDawutey, Acting Deputy Director of the Innovation Unit with the VA. Hi, Sarah, how are you?
I'm doing great today, Jordan.
Sarah, could you tell me a little bit more about your role inside the VA? What is it you do as the Acting Deputy Director of Innovations?
It's hard to summarize that, but essentially in the VAIU or the VA Innovation Unit, we work to accelerate innovations across all of VA so that we're able to more quickly access innovative healthcare and benefits solutions to save veterans and VA time and money. We focus on doing this through low to no cost pilots, and this allows us not only to save the taxpayer dollars, but it also allows the VA to try out solutions prior to making an expensive, time-consuming commitment without the certainty that the product meets our needs and provides the impact that we desire. The VA Innovation Unit also serves as an orchestrator of innovation investments, identifying and integrating innovative solutions. Additionally, it also helps in executing a variety of activities that drive innovation across VHA, VBA, and within our community of technology professionals. Our pilots touch many areas in the VA, from AI, predictive medicine, to improve patient movement from admission to discharge within a VA facility.
That's awesome. Can you tell me a little bit more about those? What have been some of the successful innovations that you've championed in the past, and how have they been successful?
Sure. One of my favorite success stories right now is Care Centra, also known as an AI personalized health coach. The Next Level Health Coach by Care Centra is a great example of a success story. It is actually the first veteran-facing AI innovation that's been released to the VA veterans. Care Centra's Health Coach is a precision nudge AI solution that focuses its machine learning around creating an individualized engagement experience for each veteran. Care Centra's solution is a unified personal health algorithm that helps each individual manage their holistic health across their entire lifetime by consuming digital behavior nudges through AI, along with their behavioral change and care journey. This algorithm over time learns to nudge a veteran to be successful and not cause alert fatigue. Another reason I really like this solution is because it also provides the ability to obtain information on diagnosis and care, reducing the number of in-person visits. Nurses engage and determine if the patient needs to be seen, ensuring that those who need a visit have more opportunity to make an appointment.
That's so interesting. When we talk about innovations and some of the things that you've mentioned, what's sort of the criteria that you're looking for when building them out? What is it that you're looking to do when you look at innovations and how they can be useful for the veteran?
That's a great question. And that lends itself back to our innovation lifecycle process that was put together by the Deputy CTO of Innovations, Ms. Angela Gant-Curtis. What we do is we take a look at the impact that this innovation could potentially have on the VA, on clinicians, veterans, or those or staff within the VA that to help deliver products. So when an innovation comes through our front door, essentially it should have a VA champion, someone who already works for the VA that is that has identified this innovation to be something that could be a game changer, solve a problem, or enhance efficiency. After they go through our intake process, we then take this innovation to a larger gate review meeting called our Phase Zero meeting, where we have representatives from across VA, DHO, OHIL, Dean, AI, leadership, OCTO, of course, VHA, VBA, NCA. And what we do is collectively take a look at the potential that this innovation may have. If there is consensus that it may be a good innovation, then we allow it to move forward and begin the low to no cost pilots, as I mentioned. Now, to get to the heart of the question of what makes an innovation successful at the VA, though, it really depends on how adaptable that innovation is. Does it solve a problem for the VA? In some industries, there's a lot of overlap of functionality between products. And so our unit is very driven to reduce duplication, have a single innovation that solves problems, that allows clinicians to access data from a single location, or how well can it integrate with current systems at the VA. All of those things are things that we look for to help identify an innovation that will have a successful journey through the VA.
You mentioned the criteria. Understanding the criteria, what does that mean on the ground? What type of innovations specifically become the ones that are followed through with these pilots?
When an innovation is successful and we decide to scale it from a small pilot to more broad adoption across the VA, it needs to be lightweight, integratable, and extremely user-friendly. It also needs to provide a benefit to the VA. Right now, a big benefit is automation of repeatable, mundane tasks. So a lot of the innovations that are coming through solve that problem for processes around the VA. For example, e-screening. This solution was actually built internally to the VA, making it more seamlessly integrated into the VA medical record. The veteran submits the data that through a survey or battery, as some people call it, and that is pushed into the medical record as an unsigned note, which satisfies clinical reminders, generates health factors, and provides measurement-based care for mental health. E-screening forms are standardized to complete national measures, as well as offering the ability to create custom forms to meet local needs. Veterans use these forms to provide information asynchronously to their providers or as a pre or post-visit check-in. This application improves the communication between provider and patient. And this product that was developed internally is also currently under regular expansion, with new features being released pretty consistently. I also want to highlight that the integration into the medical record, which we talk about sometimes needing or having the data that providers need to make good clinical decisions, e-screening leads the way as far as providing that data to providers. Additionally, e-screening has been adopted or implemented across 43 different medical centers within the VA, and there's another 29 that are in progress of adopting this innovation. So this is a really good example of something that started off very small as an idea within the VA. We got some good data. We continued to keep our users at the center of what was developed, and that allowed it to be those three things that I mentioned. It's lightweight, meaning they don't have to go into several other systems to find this data. It pushes it right into the medical record. It solves a problem of communication asynchronously with a patient, and it's user-friendly. If it's not user-friendly, no one will use it. So we try to ensure that all of our innovations have that as a factor.
And, thinking about the pilots you do, understanding that they're low cost, how do you determine which ones will make it to scale and what to do with the ones that might not be as successful?
The innovations that make it to scale, we look for a permanent home. So the VA Innovation Unit is typically a pipeline to get new innovations and new products into the VA. And once we make a collective data-driven decision around the efficacy of an innovation, we then start shopping for its forever home. That could be a national program office. It could be, a team within, say, vehicle or central office. It really just depends on who has the most interest and investment in that particular innovation. Now, a lot of times things don't succeed, especially when we're talking about, innovations and trying things out. Of course, when we pilot things, they often don't pan out. We can't change or fix that, but what we do is focus on learning from our mistakes and trying to do better next time. Also, I just want to point out that this is why our process of focusing on the low to no cost pilots is vital. When solutions don't work out, we have not lost anything, particularly money. We have, invested time and resources, but not financial. This also reduces the need to hold on to something because we have invested in it financially, which a lot of times, people will feel like they don't want it to fail because it costs so much money. So we kind of remove that barrier from decommissioning something that doesn't work. Now, once it's decided that it's not going to go to scale, we have a couple of paths forward for decommission. Decommission could include completely removing all resources, whether those are cloud or hardware, software, or if the sites that wanted to pilot this choose to continue piloting it, they have the opportunity, or continue using it, they have the opportunity to do so. But again, that would be considered a transition from VAIU support to local support.
Sarah, I wanted to ask, thinking about the VA's role in building out these innovations, I know throughout the agency, throughout government, there's always a look and a hope to work with industry. And how does that translate to the VA Innovation Unit? How do you work with industry to build out these innovations and hopefully scale them?
Yeah, industry is really a big driver for innovation, whether that be technology or healthcare. Industry has the opportunity to foster innovations through enhancing existing technologies and process, as well as challenging the status quos. VA aims to really align with industry standards where needed, although keeping in mind our very unique patient population and tool stack. Industry leaders have the ability to iterate faster to more broader solutions. Our goal in the VAIU is to partner with industry leaders as much as possible so that the VA can help shape the industry. VA's perspective is extremely unique as we are the largest integrated health system within the United States, and our strength is in the quantity of data that we possess, making us a really great partner for industry to work with as they develop new solutions.
And thinking about the VA's role as a leader in healthcare, how do you use the innovations that your department creates to help lead or show other agencies the benefits of such a system?
As a long-standing institution, the VA has a very lengthy history of research and development. Keeping up with innovations and emerging technologies is one of VA's strategic priorities. So for decades, we've been focused on enhancing the well-being of veterans and the nation through discovery and innovation. We aim to identify, evaluate, and implement emerging technologies to improve veterans' health and well-being, as well as how we deliver benefits and services to our veterans. The VA continues to use results from veteran research, quantitative user data, and benefit utilization to validate design hypothesis and shape the evolution of automation and other modernization efforts.
Sarah, there's a lot of really interesting things coming out of the VA's innovation department. Is there anything else you wanted to share?
Yeah, I just want to share overall that VA is committed to innovation and actively seeking out and implementing cutting edge solutions to enhance the delivery of care veterans receive. At the VA, our innovation process is really designed to guide ideas from inception through scale, ensuring that every solution we develop is carefully crafted to benefit VA's network and data, ultimately improving veteran care and how well we deliver benefits and services. VA's successes demonstrate our commitment to enhancing veteran care, while our openness to learning from challenges ensures that we continue to evolve and lead in innovation.
Absolutely. Well, Sarah, thanks again for joining us on the show.
Thank you, Jordan.
Thank you for listening. If you like what you heard, please leave a 5-star rating and review on the podcast platform of your choice. And don't forget to tell a friend. We'll be back next week with a new episode on the GovCIO Media and Research podcast feed. But until then, I'm Jordan McDonald, and thank you for listening.
GovCast, along with HealthCast and CyberCast, is a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new episodes every Tuesday. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.